Well, hello and good morning. My name is Brett Buttle. I'm proud to serve as president of the Public-Private Strategies Institute and founder of Public-Private Strategies. We are so thrilled to have so many amazing speakers join us this morning for what we know is a really important conversation about what is going on in the small group market. Over the last year, Public-Private Strategies Institute, with the support of the Robert Wood Johnson Foundation, undertook a year-long research project. After doing a poll of over 500 small business owners, as well as talking to many small business leaders, advocates, health insurance, health market experts, we're releasing a report today that takes a view at what's going on in the small group health insurance market. We look at new benefit options under health reimbursement arrangements, including ICHRAs and QSARAs. We look at cost and look how small business owners are feeling about the market generally. With that, we are so pleased to be able to share some of the results of the report today, as well as have a series of leaders from across the spectrum, both inside and outside of government, as well as folks who have deep experience in the private market to discuss these findings and the current state of affairs for small business in the health insurance market. We're so pleased to have you with us today. We will make sure to take question and answer as part of the event, so we look forward to hearing from you as well today. And with that, let's go ahead and get started. It is now my pleasure to turn the conversation over to Emily Barson, who served as Director of External and Intergovernmental Affairs in the Obama administration and now serves as Senior Advisor at Public-Private Strategies. Emily, over to you.
Thanks, Rhett, and thanks everyone so much for joining us today. As Rhett noted, we are going to share some context, really looking at the importance of small businesses, where they fit in the healthcare coverage puzzle, and how some of the new options available to small businesses impact their decision-making. We'll discuss the findings that we are releasing today in our new report and the key takeaways, and then that will lead us into an all-star panel to discuss various perspectives on the small and medium employer market. As this audience knows well, small business is a key contributor to the U.S. economy. They are drivers of job creation and innovation. And while many have faced challenging times these last few years, we've also seen a whole wave of innovation in the small business space that has continued to drive our economy. Small businesses also serve as a key piece of the healthcare coverage puzzle in the country, knowing that most people still get their insurance through their employer, but rising costs have consistently ranked as the biggest issue and barrier for small businesses as they consider offering healthcare benefits for their workforce. This puts them at a competitive disadvantage to larger businesses that are able to offer group plans, especially in a tight labor market, like we've seen recently. And these effects are most pronounced for women and minority-owned businesses. Thanks to our partnership with the Robert Wood Johnson Foundation, we embarked on this project to really explore the evolving link between benefits and employment, with a focus on the small and medium employer market, as well as examining small business owners and decision makers' knowledge and views of coverage options available to them. Our research included a series of interviews with small business owners and organizations, direct market participants, and third-party stakeholders. And we also partnered with Morning Consult to conduct a survey of 500 small business owners and healthcare decision makers. Those results both inform this event and this discussion, and are also reflected in the report that we are releasing today in conjunction with this event. Echoing previous polling of small business owners, our survey reflected that the 4 most important healthcare issues for policymakers to address are cost-related. Nearly all stakeholders that we interviewed also cited cost as the #1 factor in a small business owner's decision whether to offer healthcare benefits. And we heard from both small business organizations and small business owners that even despite wanting to offer benefits, oftentimes it was cheaper for employees to get covered on the individual exchange, especially given the increased federal subsidies that have become available through the COVID-19 pandemic and recent legislation. Our research also showed the specific ways that small business owners have to make difficult decisions because of the rising cost of healthcare, which impacts both the type of healthcare they can offer and the cost sharing that they have to decide for their employees, but also decisions outside of the benefit space, like holding off on promotions or raises that are all come down to the rising cost and the predictability of small business owners knowing what they can afford to offer and try to retain and recruit the top talent that they can find. As we explored knowledge of new benefit options, our research found that small business leaders were largely unfamiliar with new health reimbursement arrangement products like ICHRA and QSERA that became available in recent years. That knowledge gap is more pronounced for businesses with under $1 million in revenue, or where the highest employee salary was less than $100,000. Just 7% of the small business leaders that we polled said that they offer ICHRA or QSERA to their employees. And of those that did, they said they offered it to allow for more choice, or that it was less expensive than traditional group plans. And of that small sample size, about 2/3 reported being satisfied with those products. So the key takeaways in today's report, can't overemphasize enough really how much we heard cost as that number one barrier for small employers regarding their healthcare benefits. There's a lack of knowledge and also just a lack of bandwidth for small employers to really research and learn some of the new healthcare options that have become available. That education from trusted sources would be most helpful to raising small business owners' awareness of their new options. And I think we'll have a chance to get into some of what that will look like and in today's panel, as well as in the next steps that we at PPSI are going to undertake in helping with some of that education. So you can see on the screen, ppsi.org/healthcare is where you can find the report. That's also where the recording from today's event will be housed, and learn more. With that, I'll turn it back over to Rhett.
Wonderful. Well, thank you so much, Emily, for setting the context for the conversation. Before we hop into our amazing panel, we're thrilled to have someone from the Biden administration join us. I'm pleased to welcome to the conversation Dr. Ellen Montz, who's at the Center for Medicare and Medicaid Services, has been working on healthcare for a variety of years, worked with many of us on the call today. And so we're so pleased to be able to have her join us to offer her perspective from where she sits on the current status and anything that she wants to share from the CMS landscape. So with that, over to you, Dr. Montz.
Great, thank you, Rhett. Good morning, everyone. And for those of you in DC, it is a beautiful one. It is great to be here with you today. Particularly as this report shows, and as we know, small employers face continued and new challenges when it comes to offering quality, affordable healthcare coverage that meets their employees' needs. I'm happy that CMS can be part of the solution to the challenges small employers face, whether it's through the small group market and shop or the marketplace. At CMS, we have come together under 6 strategic pillars: advancing health equity, expanding access, engaging partners, driving innovation, protecting programs, and fostering excellence. The continued work we do at CSIO and in this administration to ensure opportunity and flexibility and health coverage for small employers fits squarely under these pillars. Let me first acknowledge what we all know, and again, this report shows, which is the changing employer landscape. We know that employers face significant challenges with finding and maintaining talent. Right now, it's harder than ever to retain long-term employees and to hire new employees with the right skill set. And we know that health insurance benefits is one of those tools employers use to attract that talent. Additionally, with significant increase in remote employment and relocation of employees during the COVID-19 pandemic, small employers increasingly face unique challenges with offering coverage in multiple states that is affordable and meets the varied needs across different geographies. And right alongside these new challenges remain the constant, which has been that the uninsured often work at small employers. As of 2017, about 20% of employees working for businesses of 50 or fewer employees were uninsured. While the uninsured rate is at an all-time low, thanks to the foundation of the Affordable Care Act, rates of employment-based health insurance coverage has dropped by 0.6 percentage points between early 2019 and early 2021. Many small businesses continue to not be able to afford to offer coverage to their employees. But the good news is that the Biden administration continues to support and innovate to help provide coverage options for small businesses. Let me highlight a few of those options. Small group markets and SHOP, options on the marketplace, both ICHRAs and premium tax credits, and finally spend a brief minute on the family affordability rule, or as us DC folks say, the family glitch. First, small group insurance and SHOP. For the more traditional approach, small employers continue to purchase insurance through the small group market, which has seen generally lower premium increases over the past few years. And for small firms, the Small Business Health Options Program, SHOP, plans offer quality, affordable health and dental insurance coverage that gives some small employers that choice and flexibility that they need. And we know there's also the Small Business Health Insurance Tax Credit, which can be worth up to 50% of an employer's contributions to premium costs, which again hits the right mark for certain firms. But for some small employers, the small group market is not the right fit. Maybe it's the varied needs of its employees or some of the new and emerging issues I mentioned a few minutes ago. The good news is there are a few options for employers on the marketplaces. Small business owners and self-employed individuals, after all, do make up 25% of our marketplace enrollment. But first, there are ICHRAs and QSARAs. Through this option, employers can provide non-tax reimbursements to employees for premiums and other out-of-pocket costs like copays and deductibles. Employees must be enrolled through the individual market health insurance coverage, and a great place to do that is through the marketplace. A few updates to announce to make coverage through this option easier. First, the marketplace application has been updated to calculate whether an ICHRA offer is affordable to a consumer and their family. The application has also been updated to allow special enrollment periods for consumers and their families who have newly been offered these coverage options by their employees. And finally, there is a new affordability tool, one for employers, one for consumers, to help determine that affordability on the front end. A second option through the marketplace is that employers might find that the role in providing employees coverage is to help those find coverage for their employees and their families by helping them shop on the marketplace and taking advantage of the premium tax credits. Net premiums are at an all-time low, particularly with the enhanced subsidies, which have significantly lowered premiums under the American Rescue Plan and now under the Inflation Reduction Act, which increased affordability for those under 400% of the federal poverty level and extended tax credits, importantly, for those above 400%, capping contributions at 8.5% of income. Small employers are very good at weighing their options and often know exactly what each and every one of their employees needs. My dad, for example, used to provide an HRA through the marketplace. He has now done the calculation and took a look at the different scenarios to cover his 4 employees and their families, and has chosen to instead provide a pay raise and help his employees through healthcare.gov to buy on the marketplace, given the new subsidy levels. Third, a few words on the so-called family glitch rule. The family glitch currently prevents an estimated 5 million family members of employed individuals from receiving marketplace subsidies. The IRS has finalized news this morning an update to that rule that would determine affordability of employer-based coverage based on all family members offered coverage, rather than only factoring the individual's required contribution. This expands subsidies, expands coverage options for family members to those millions of Americans I just mentioned. The final rule posts today, and we are prepared on the marketplace to reflect these new rules in all of our application interfaces, beginning with open enrollment that starts in a few short weeks on November 1st. So this rule will be reflected in our online at healthcare.gov, through the call center, and with trainings with our assisters, navigators, and our agent and brokers that I know many of you all work with. One final point and an ask from me on one of our top priorities for the Department of Health and Human Services and this administration. As we all know, the end of the public health emergency, which could come in the next few months, will mean that millions of current Medicaid and CHIP enrollees will be at risk for coverage loss. And so many of these folks work for small employers. I'm asking that you all, as a stakeholder group, come together to make sure folks find their way into the right coverage, whether it's back with Medicaid and CHIP, whether it's a new coverage on the marketplace, or coverage through the employer provided coverage. Let me end by saying that I know how important it is for small business employers to know that their employees and their employees' families are well provided for so that they can thrive at home and at work. I'm happy that CIO, CMS, HHS, this administration is able to provide flexible options to ensure health insurance coverage is there for your employees. Thank you. With that, I'll turn it over to Rhett.
Wonderful. Well, thank you, Dr. Muntz, for making time during what we know is an incredibly busy period. And we saw this morning that the family glitch rule was finalized. So a busy morning, and I'm sure we'll provide some fodder for what is going to be a great conversation. So with that, it's my pleasure to turn the conversation over to the moderator of our esteemed panel, and she will introduce the panel. So I'm turning it over to Ariana Khalid, who's with FGS Global Consulting and former Chief of Staff to CMS. So Ariana, over to you.
Great. Thank you, Rhett. Good morning, everyone. It's a pleasure to be here with you today. As we've just heard from both Emily and Ellen, that traditional employer-employee relationship is continuing to evolve. And that historical link between employment and how workers receive their benefits is also evolving. You all know, as well as any of us do, that healthcare in the United States is complicated, and insuring people as a small business owner is complicated. As the research released today shows, cost concerns are abundant, and there's a lack of awareness about new innovations taking place in the small group market. So I'm personally really looking forward to hearing, and I hope you are too, what our expert panelists view as the challenges and opportunities in expanding healthcare coverage among small businesses and their employees. As Ellen mentioned, that might include fixing the family glitch, which sounds like this morning we got some good news there. New options on ICHRA and QSERA, enrollment in the marketplace, among other ideas and innovations. So with that, let me start by introducing each of our panelists. First up is Brian Blais. He's the president of Paragon Health Institute. He was special assistant to the president for economic policy at the White House National Economic Council from 2017 to 2019. Next, we have Commissioner Jean Lambrou. She's charged with leading the Department of Health and Human Services efforts to serve Maine's most vulnerable, including providing healthcare and social support to low-income families, children, and elderly Mainers. Jean has held several senior positions at the White House for 10 years and at the Department of Health and Human Services for 4 years. We have Catherine Hempstead. She is a policy advisor at the Robert Wood Johnson Foundation. She works on healthcare issues, mostly those related to health insurance, costs, and access to care. And finally, we have Dr. Erica Gonzalez. She is the CEO and president of both South Texas Allergy and Asthma Medical Professionals and the STAMP Clinical Research. Before opening her business, Dr. Gonzalez served 10 years in the United States Air Force. She is very active and involved as a business owner and community leader. Among her many boards and advisory posts, Dr. Gonzalez chairs the Mayor's Commission on Status of Women, is chairwoman for the San Antonio Hispanic Chamber of Commerce, is on the board of directors for Latino Victory Project, and was selected as a 2019 Presidential Scholar. So with that, I'd like to welcome our panelists. To begin, I would like to get our panelists' opening thoughts on the small group market from their perspectives and backgrounds. Brian, why don't we start with you, and then we'll go to Jean, Erica, and Catherine.
Sure, thanks, Ariana. When I was in the White House at the National Economic Council in the summer of 2017, Congress was debating efforts to reform the ACA, and we were looking at what administrative options were available to us to help individuals that had been harmed by policy over the previous decade. And one set of those individuals was small businesses and their employees. So from 2010 to 2018, there was about a 25% decline in the number of small businesses offering coverage and the number of workers at small businesses enrolled in employer coverage. We came up with two ways to expand options for small businesses and their workers. The first was association health plans, allowing small businesses to join together to gain some of the regulatory advantages and economies of scale that large employers get when offering health insurance. And the second was the creation of individual coverage health reimbursement arrangements. This policy was about addressing sort of two major problems with employer-provided coverage. One, for employees, a lack of choice. Most employees only get an option of one or two plans that are chosen by their employer. So they lack choice over health insurance, which is a major financial expense for most families. For employers, there's a lot of frustrations with offering health insurance. You've got to try to figure out one plan that works for all your workers under a traditional group plan. You've got to make sure there's a substantial take-up rate. You've got to go through the annual renewal process. So really, the analogy with ICHRAs is 401ks, where the employer provides a contribution and the employee takes that contribution and uses it to pick the plan that works best for them in the individual market. And that rule took effect January 2020. And I know there's an organization called the Hra Council, which is formed to support the growth of defined contribution health insurance. And they've seen, they have a survey out to their members, and they've seen significant growth in both the QSERAs, the small employer HRAs, as well as ICHRAs since 2020.
Great, thank you, Brian. Jean?
Great. Thank you, Ariana, for moderating this panel. And I do want to send a shout out to Rep Buttle. He has long been a champion for small business health insurance, and I appreciate being invited to this panel today. So I'm going to pull up a bit and talk about federal and state role in employer-based policy, particularly small group, given that I have now had experience at both the federal and state level. I'll just make 3 points. The first is that as a background, it's important to remember that the United States is unique in the fact that most people covered in this country are covered through employment-based health insurance. That's an outgrowth of policy from World War II related to health benefits that has persisted. So 70 years later, when we were developing the Affordable Care Act, we had to assess what changes, if any, should occur with employer-based insurance. As a reminder, Senator McCain had run for president in 2008, rallying to end the tax break for employer-based insurance. And the intention behind that phrase, if you like your health plan, you can keep it, was about employer-based coverage. That is why the Affordable Care Act included shared employer responsibility, which is about trying to maintain coverage for large employers, a policy that remains in place today. It is why employer-sponsored insurance has only declined slightly in the past 25 years, despite cost increases. It is also why when I drive around Maine today, in addition to seeing signs with bonuses for recruiting nurses or CNAs to nursing facilities, I see signs saying health insurance offered here at restaurants and small sandwich shops. Bottom line is people value employer-based insurance, potentially beyond its economic value, which is why we still have that in public policy as a priority today. This brings me to my second point about small group insurance. By definition, is more challenging than large groups. It's easier to see a small business's risk profile given this size. There's a smaller group of people over which to spread that risk. And typically they've paid higher rates than large businesses with less ability to negotiate prices. Small businesses are also more likely to start as self-employment, to have a small number of workers and then grow, which is why there is back and forth between the individual market, the non-group market, and the small group market. Which leads to a third point, which is there's a lot of state activity going on in small groups. You know, the ACA did apply a bunch of its policies, such as essential health benefits, its rating reforms, and risk adjustment to the small group recognition market in recognition of this back and forth. As Dr. Mons said in her opening comments, 25% of exchange enrollees today are either small business owners or self-employed people. And the ACA did try to encourage small business coverage through SHOP and through premium tax credits. I think it's important to recognize that ACA also really acknowledged the role of states, including SHOP, the small business marketplace, and the ability of states to seek 1332 waivers. Which leads me to my last point. Due to the ACA and the fact that small group market is largely fully insured, which means it's state regulated, state policy has had and will continue to have a major, if not predominant, role in making small group insurance affordable and accessible. Hawaii has the highest rate of employers offering coverage to their small businesses, and that's because of policy that predates the ACA. The SHOP program is probably most successful in the District of Columbia because it's been able to use that program, leveraging members of Congress who purchased through it with small businesses to make that coverage affordable. In states like Massachusetts and Maine, I'm happy to talk about Maine more later, have really taken advantage of numerous tools at the state level to make coverage affordable. So while there is definitely a role for the federal government in promoting affordable and accessible small group coverage, we can't forget states in this discussion. Thank you.
Thank you, Jane. Dr. Gonzalez?
Good morning. It's a pleasure to be here this morning to be able to give some perspective on how all this impacts the small business owner and their employees. Through my work with the San Antonio Hispanic Chamber, I've heard from various small businesses that healthcare is one of the things that is most, the cost of healthcare is one of the things that is most concerning to them and that seems to impact them the most. The majority of the time, being able to get healthcare for their employees is cost prohibitive. And it's become really crucial right now as the job market becomes more and more competitive that they try to find ways to be able to offer this benefit in order to be able to recruit and retain top talent in their organizations. There also is the issue that when they do offer health insurance and are able to find a way to cover this, as one of our previous panelists, Brian, was saying, you know, there is one plan that the employers will cover. And often the employee can change according to their needs, but they're going to have to pay the difference. And so that's often not possible to the employee. And what ends up happening is that they're enrolled in these healthcare plans that have extremely high deductibles that don't cover all of their healthcare needs. And so it almost becomes not very effective for them to have the health insurance. And so oftentimes, you know, it's not helping the way that we want it to help.
Great. Thank you, Dr. Gonzalez. Catherine?
Hi, everybody. Thank you very much. It's hard to go last because so many excellent points have already been made, but I'll just throw in a few comments. I think the points that Emily made about the importance of small business to our economy and to innovation and economic growth were really, really fundamental. And you know, it's a it's a huge liability for small employers when they're not able to offer coverage, since there is such a premium placed in our society on the idea of employer-sponsored coverage. So for those reasons, it's really important that we develop some new opportunities for small employers. And I think ICHRA and QSERA and sort of the individual market in general does that. I think another point I would just make is that the sort of problems with ESI are, the affordability problem, is not something that's limited to small employers. And I think that that's something that everybody knows, but certainly a lot of other work that we do at the foundation is really focused on affordability problems and employer-sponsored insurance kind of writ large. In fact, particularly in self-insured employers, and looking at the high hospital rates that they pay, the affordability problems, how it eats into employees' wages, and, just the sort of, many manifestations of the affordability issues in the large group context as well. And certainly, the word unsustainable is often mentioned by purchaser groups and groups of employers, sort of talking about the fact that the share of wages that's getting consumed by health insurance premiums is escalating to a point where it's not something that large employers are necessarily comfortable with. So I think the individual market created by the ACA is something that our society desperately needed. It filled a hole that was, certainly very important for the uninsured, which was maybe the primary purpose. But I think it also starts to create sort of a credible alternative to employer-sponsored insurance that, as Jean mentioned, is kind of a holdover system that I don't think that anybody would have designed from scratch right now. Something that a few of the other panelists have brought up also is the issue of choice or lack thereof in many employer-sponsored insurance contexts. And I thought the sort of brief and unsuccessful attempt to create a sort of private exchange environment in employer-sponsored insurance after the inception of the ACA, I think, reflected the demand for choice, but also the great difficulty in satisfying that demand within the traditional employer-sponsored context. So I think for all those reasons, the model presented by the individual market is important for us to consider. Just, one more thing I would mention, that hasn't come up yet, and I hope that we'll talk about is, I think, when you talk about ICHRA, I think there are a lot of fans and a lot of foes. You hear from a lot of people that are really enthusiastic about these options, and then there's a contingent of people that are very concerned about ICHRA, because perhaps it's affecting the status quo, or perhaps they're concerns about the potential for ICHRA to have negative effects on the individual market if it turned out to be the case that there was a process of adverse selection where sicker employees would disproportionately go into the individual market, and that would have a negative effect on premiums. So that's something that I think everybody would like to know more about. And one of the things about ICHRA and QSARA it's right now is that there's a real absence of data. I think the initial prediction was that 11 million folks would be enrolled in ICHRA within 5 years. And I think it's pretty fair to say that hasn't happened. But, what we don't know is, how much enrollment is there? Who is it? Who's using it? What do people think? And that's why, we were interested in sponsoring this survey and hearing, what we can learn so far from talking to employers. And, what we saw there is that there seems to be a huge opportunity for growth, which is another way of saying, very low prevalence so far. But I think there's, a real thirst for knowledge among, people that are interested in the potential of this mechanism. So with that, I'll turn it back and look forward to the conversation.
Great. Thank you all for your comments. I thought they were very insightful and helpful. So why don't I start with some questions for folks in the audience? If you'd like to ask a question, please use the Q&A function and we'll be monitoring. But I'll get started. Brian, why don't we turn over to you first? There's, seems to be general agreement that the employer market is critical when it comes to access, at least right now, as our markets are constructed currently. Where do you think there are bipartisan opportunities to support small employers?
Well, let me go back to ICHRA's. I think ICHRA's is really a bipartisan sweet spot because, if you go to conservative center-right health policy books for decades, they will have written chapter number 1 about the problem with the way the exclusion works and that the employer is selecting and really in charge of the options that the employee and that employee's family has for health coverage. So it has been figuring out how do we equalize tax treatment so that the government is not providing such a huge advantage for employer-provided health insurance coverage. And, Senator McCain's 2008 proposal was brought up up, that was one way that he was going to do that, was provide a universal tax credit. I think the ICHRA approach is really just saying it's an option for employers, and employees that select this option get the same tax advantage. So they don't pay income or payroll tax on the employer share of the premium or the employee share of the premium. So really the ICHRA at its core, it's a way to create tax equity between the employer provided and selected plan and the employer contribution for the individual to select coverage. So that appeals to conservatives. For Democrats, it is integration with ACA compliant plans in the individual market. So it is a way to expand the number of people enrolled in individual market coverage. Catherine correctly cited the models that the previous administration used, which were done by the Department of Treasury, that had about 800,000 employers offering ICHRAs and about 11 million people enrolled in the individual market with ICHRAs by the time that it reached sort of its equilibrium state, which is going to be, a few years from now, like 2025. I agree that uptake has been lower than was projected. We also had a pandemic, and I think the pandemic really caused a lot of changes in the employer-provided coverage space. Employees are in high demand, and I think employers are very resistant to make changes to employer-provided coverage right now for fear of what that does to employees. I do think the way we're going to see ICHRA adoption is with younger firms that haven't established, like they don't have employees that have established providers, hospitals, doctors that they must have in their network. Because as we know, individual market plans tend to be more restrictive than a traditional group plan. So I think the economics of sort of a choice suggests that ICHRAs will lead to improved sort of risk pool in the individual market. But I agree with Catherine that we still need more data along those lines.
Thank you, Brian. Jean, as someone who was so involved in implementing the ACA, what are your thoughts on the current status of the healthcare market just generally?
Sure. And I think I might just build on what Brian just said, because I do think the health policy history and graveyard is littered with many ideas to try to help small businesses, many of which don't have high take-up or participation because they're complicated. I just need to say that, like ICHRAs, and I've talked to people here in Maine about them, people glaze over, it's hard for them to understand it, to administer it. It's complicated. Same with the Affordable Care Act small group health insurance tax credit. I mean, we had a tax credit that was grossly underused in the first 5 years of the implementation of the law, in part because it was a very complicated benefit design intended to be targeted, which is always what we do in our tax policy, try to figure out how do we target those low-wage, small businesses that need the most help. But fitting that into kind of a larger system is challenging without wide swings from one direction to the other. I would say, and I'm happy to talk about this when we talk about what we've done successfully in Maine, is use 2 words to guide our policy: simplification and integration. How do we pick, where we want our small groups to get their coverage? Some proposals, like association health plans, try to move them into bigger groups like large businesses. Some, like ICHRA, try to move people in the individual market. But trying to figure out which direction we're going in, and then trying to be consistently, thematically developing policy that moves folks towards one or the other, I think is the way to go, because the reality is, again, structurally, trying to build a whole system to just ensure small businesses, given their necessary volatility, their growth, their dynamism, is really challenging from a public policy perspective.
Thank you, Jean. We've had some questions come in for the audience, so I will put this up to the entire panel, and whoever wants to jump in, please feel free. The Affordable Care Act established the SHOP. What do you think about how the SHOP is currently functioning? Why aren't more small employers using it?
Guess I'll jump in. some states it is working well and there's a high participation. It takes active work to make it a useful venue as an alternative to other different ways that small businesses get coverage, like through agents and brokers. So I think it can work and does work in places where there's been an investment of time and energy. I will flip it around and say, I think at the end of the day, while I appreciate what Brian and Catherine said about people wanting choice, I think they want affordability probably more than choice. So I think sometimes we overstate the desire for businesses and their workers to have choice. If they can find an affordable plan that covers the basics, they often go for it. So I think for those reasons, lack of intense work in some areas and kind of a priority of cost over choice, I think that's sort of the reason why it hasn't really taken off, but welcome others' views.
Thanks, Jane. Erica, as someone who isn't just a small business owner, but is also involved with several small business groups, what do you think policymakers need to know when thinking about healthcare policy for small employers?
Sure. So as we've already discussed and various points have been made, one of the most important things for small employers is to be able to provide healthcare for their employees. This not only because our employees are our greatest assets. So especially in a small business, they become part of our extended family. And so we know that it's not only the right thing to do, but also the thing that we should be doing. Unfortunately, cost continues to be the biggest barrier to being able to offer this to our employees. And so what policymakers should focus on is finding a way to be able to lower these health costs. We know that overall, one employee a year costs an employer about $3,600 per year in missed work days. We also know that when employees go to work because they know they can't miss a day, they don't have the PTO, their productivity is about 60% less. And that also contributes to the over $575 billion that are lost in revenue in small businesses a year. And so it does have a tremendous economic impact. And so they need to kind of focus on that and realize that it's not just affecting the small business and the employees, but it's affecting the economy as a whole.
I completely agree with that. Another question from the audience. What do you think the provisions of the Inflation Reduction Act mean for small employers? Any thoughts from anyone?
Sure, I can go. The key provision of the Inflation Reduction Act that's going to affect employer-sponsored insurance is increasing the ACA premium tax credits. So they're increased in two ways. One, for everyone who currently receives them, the subsidy increases. So the amount that families have to pay out of pocket goes down. Second thing that was done is the cap was lifted at 400% of the poverty line. So previously, you had to have income below that level of poverty line to access premium tax credit. That cap is now lifted. You can't get a premium tax credit if you get an offer of affordable employer health coverage. So there is an incentive for employers, particularly small employers, because big employers are still subject to the employer mandate tax penalties, like Jean mentioned. Large employers are going to continue to offer coverage, but for small employers, they could drop coverage, increase wages, and have employees get the expanded premium tax credits. That's the clear incentive. The question is, what's the magnitude of that going to be? The Congressional Budget Office, I'm doing this off of memory, I believe they estimate that's going to be about 2 million employees that replace employer-provided coverage with subsidized coverage in the exchanges. So it's going to lead to a decrease in the offering of coverage for small employers, particularly given the family glitch fix that was announced today. That will lead employers with an incentive to stop making affordable offers for dependents, because now dependents can access premium tax credits to purchase policy on the exchanges. So those two things combined, I think, will significantly increase the incentive for small employers not to offer coverage.
Sure. I just have two points, if you don't mind, Ariana. One is, I think we should just remember that the American Rescue Plan first included those two policy changes that Brian described, and it got extended in the Inflation Reduction Act, primarily because pandemic has not just affected small businesses, work kind of environments like it did in 2020 when there were some shutdowns and other dramatic changes to our different, communities, but also because we're seeing now the pandemic effects continue in the cost of healthcare. Here in Maine, like many other states, the inflation is hitting our hospitals, our nursing homes very hard. We see wages that are extremely high, travel nursing costs that are driving up the cost of healthcare, which put aside the cost of health insurance. The cost of healthcare is really what drives health insurance costs. And that additional assistance has been critical, as Dr. Mons said at the outset, in keeping people coverage, in increasing the number of people with insurance, which with the pandemic continuing this fall has been critical. So we're just so grateful that the Inflation Reduction Act has come along and solved a couple of the challenges that individuals were facing in the individual market. I will flip this around and say, I think that there's a lot of people who would wish we could have the kind of will at the federal level to expand and improve upon the tax breaks for employer-based coverage, making it more progressive rather than regressive, and really fixing some of the flaws in it. But it's been many years since I've seen those big types of proposals, and I don't see anything on the short-term horizon, which is why in the short term, we really should try to provide assistance in places where we know it's needed, recognizing that it could have other consequences like more small businesses going to the exchanges versus maintaining their own small group coverage.
I would just jump in that those two changes that make individual market coverage more affordable, I think can serve to kind of normalize the use of the individual market as a strategy for small employers. And, there's an estimate of a growth of 2 million, but I think, it also can sort of be behaviorally important and, help more and more small employers to think about the individual market as a destination. Because agree with Jean that affordability issues are really significant, and we've all heard stories about huge premium increases. I know in New Jersey, our state employee plan got a 20% premium increase, and there's various stories around the country, large and small employers getting sticker shock when it's time for renewals.
That actually leads into into a question from one of our audience members. And that question is, doesn't the drive towards ICRAs and QSARAs, and I would add in this push into the individual market, although Gina, I agree the subsidies were definitely needed, mean we should revisit the employer-sponsored health insurance system and strengthen the individual markets? What do you think about what this trend means for ESI overall? So Catherine, why don't we start with you? Because I have a feeling your comments at the beginning kind of prompted this thought of like, why are we even in an ESI anymore? And will there be a tipping point?
Well, yeah, I think about tipping point a lot. I mean, I do think that, ESI is a little bit of a holy grail. I think people consider that to be the definition of a quote unquote good job is a job that has benefits. And, there's, as we've been sort of framing this whole session, it's a huge challenge for small employers, and the small employer market, has always been, for all the reasons we've discussed, been more expensive and been sort of poorer coverage, but there's this enormous pressure to provide this coverage because that's been kind of the standard. But I think it's a model that's, I think, problematic for employers. It's not necessarily great for employees, but they don't know anything different. And it also, I think has, until we had the individual market, created this very inequitable system of sort of haves and have nots, where people that didn't get that coverage really didn't have an alternative. And now, now there is an alternative. And I think that alternative is becoming more and more robust. But I think, will we, and if so, how will we sort of migrate away from a primarily employer-based system? I think the way that we will do it is by having a credible alternative, which we now have in the individual market. And I think that, an interesting question will be, what will that what will that migration look like? I think what Jean has said about complexity is really important. And I do think that the numbers that we see right now are still very low, but what will it look like if we're able to sort of diffuse this new idea among employers first smaller, then maybe larger, that there is another way to approach that. And then will we change our tax policy ultimately to reflect that so that it's easier to do. I'm very interested in seeing what that might look like. And that's one of the reasons that I think it's important for, to fund some outreach to employers to find out, what are they thinking about? Who do they trust? How might they learn something new about coverage options? And then how will we evaluate, how that's received? And importantly, what's it like for employees, which I think is something that we kind of know the least about.
Just jumping in here, I think one thing we've learned since the ACA took effect is that employer coverage is pretty sustainable. So there were estimates when the ACA took effect. McKinsey and Company did a survey of employers back at, I think, 2011, and they had a finding that like 25% of employers could drop coverage and navigate employees to the individual market with the premium tax credits. Got a lot of attention at the time. It didn't happen, right? I think from 2014 to 2019, the number of employees that migrated to the individual market because of the ACA was probably 1 to 2 million, which was significantly less than CBO estimated. They estimated it would be about 8 million people. So employer provided coverage has been pretty robust to policy changes. The ACA tried to address problems with the regressive nature of the exclusion that the government was, in addition to the regressive nature of the exclusion, that the government was fueling inflationary health spending by subsidizing high cost health insurance plans, not subjecting the premiums to taxes. They had the Cadillac tax. It was one of my favorite elements of the ACA. And it was along with 3 members of Congress, because when it came up for a vote to repeal, 3 members of the House of Representatives voted against repeal of the Cadillac tax. So addressing the exclusion does not have a lot of political support in the Congress. I would make one point here too about just levels of government spending. The US has $1 trillion deficit. A lot of the problems with our fiscal situation are the growth of entitlement programs and our health commitments. One of the main benefits right now for employer provided coverage is that the average tax expenditure, the loss of government revenue, is about $2,000 per each individual that gets employer provided coverage. If you compare that to the average size of a premium tax credit for the ACA, the premium tax credit is much larger. So if you just have people migrating from employer provided coverage to the ACA with these expanded premium tax credits, you're really going to have a lot of additional fiscal pressures at a time when the US fiscal position should be about reducing unsustainable spending and trying to get our deficits under control.
Another question from the audience, and this one's about high deductibles. And so I'm going to paraphrase the question a little bit. I think what the audience member is asking is, when we kind of drive people into these high deductible plans because it's the lowest premium plan and they decide that's what the consumer wants to purchase, what can, if anything, the government do to help cover some of the high deductibles? And they make the point that wouldn't it be better for the government to cover some of the $10,000 payment rather than have folks go on to Medicaid or be under or uninsured? So Brian, this is kind of sort of tied to what you were just talking about a little bit. Is there a different way or a way to help deal with high deductibles but keep people in the private market?
So the ACA has a program called the Cost Sharing Reduction Program. It's really better thought of as it's another government subsidy. It's paid to health insurance companies, and insurance companies take that subsidy and they reduce out-of-pocket payments for enrollees, out-of-pocket payments like deductibles, co-payments, maximum out-of-pocket limits. So people under 250% of the poverty line qualify for that subsidy. Paragon, the think tank that I lead, we actually have a policy proposal called the HSA option, which would allow those low-income enrollees, instead of taking the subsidy as a payment to the health insurance company, for the health insurance company to figure out how to reduce deductibles, for the individual to take that as an HSA contribution. So the individual takes the value of that subsidy, they control it, and they can figure out how to best spend the resources on the healthcare that they need and prefer.
Jean, Catherine, Erica, any thoughts on the high deductible piece? All right.
I would just say, I mean, cost sharing in general, I think there's a lot of interest, you know, in the marketplace and state policy to try to standardize and create some limits on cost sharing, especially for certain kinds of conditions. I think there's been some, you know, interesting benefit design proposals around mental health, around diabetes, you know, and I think things like that, you know, to a certain extent, you're squeezing a balloon and you're reducing costs in some places, and maybe, you know, ultimately you're increasing premiums depending on, you know, how things are financed. But I think there's a widespread concern about cost sharing to a degree that it really interferes with people's ability to access care. And one of the things that we've noticed in the individual market over the years is that having services available before the deductible with a copay is you know, becoming more common. And in fact, you know, that's a way that sort of the average individual silver plan, you know, at least for some services like primary care, mental health, differs from the silver plan in the small group market in terms of, you know, the likelihood that people have to satisfy the deductible before they're able to engage in cost sharing to get services.
Yeah, and I'll just add a couple of things, Ariana. Number one, the Affordable Care Act include the preventive services provision. That means that all preventive services meeting certain criteria can be covered first dollar below the deductible. States have also taken up what Catherine just mentioned. Here in Maine, we adopted a standardized set of copays and deductibles called Clear Choice Plans that, for example, say that your first few couple of primary care and behavioral health visits need to be covered below the deductible without waiting for that deductible to be met. To use your benefit design to promote the types of access to care that at the front end early on are critical to people's well-being. So you can design federal level, state level cost sharing designs to mitigate some of the concerns about high deductible health plans.
Great. I'm going to ask one last question from our audience, and then we will wrap up, and I'll ask each of you if you have anything else you would like to say that we haven't covered yet. The last question from the audience is, today, as we heard earlier from Dr. Montz, the administration announced its intention to make changes to the family glitch. Does this have an impact on employers? And can someone walk through that impact? Jean, you want to go first?
I think Brian explained this a little bit earlier, so I'll just summarize, right? I mean, it does mean that more dependents will be able to access the individual market and subsidies in the Affordable Care Act and exchanges, which could mean that fewer employers are offering coverage. I'll flip it around. I think it's always been a strangeness of the Affordable Care Act that I think, again, is called the glitch because it was not a design flaw feature. It's not chosen necessarily. It was an unintended consequence. So I, again, will say, I'm going to repeat what Brian said. I'm not repeating a couple of things of what he said. People do like employer-based coverage, though. It still is important for a lot of people to get their health benefits through their jobs. So I think it will have some effect, but not a dramatic effect as some might predict. Brian, did I get that right?
Yeah, you did, particularly the points where you agree with me. That's
It's not all of them, no. I will just say that for the record.
Yeah, I mean, I could sort of restate it again. The affordability was based on self-only coverage. So employers didn't have to look at the price of family coverage to make an affordable offer. If they offered self-only coverage and family coverage, they provide a little contribution for family coverage. As long as the self-only coverage was affordable, the dependents couldn't access a premium tax credit to buy their own plan. What this is going to do is it's going to look at the affordability test for family coverage. So more dependents will find that the offer of employer coverage is not affordable to them. So the employee will remain on the group plan, but the dependents would then have the option. They could remain on the group plan, or they could access a premium tax credit and purchase in the exchange. Most people in the family glitch already have coverage. 90% of the dependents are already on a group plan. So it's not going to increase the number of people with health insurance by that much. It is, I mean, one of the interesting things with ICHRAs, and I'm interested to see this in the final rule, is whether the employee can take an ICHRA that they're offered, and the dependents can take a premium tax credit that they're offered because it's a lack of affordable plan, and combine them to stay on the same policy in the individual market. That is not something that was included in the proposed rule. It's something that I know there was comment letters on, and we'll see if it's addressed in the final rule.
Great, thank you. So with that, we have a few minutes left. Jean, anything else you'd like to say? And we'll kind of go around the panel.
Yes, I had not had a chance to talk about some optimism and some hope from the state of Maine. So a reminder, like most states, back in 2018, our Maine State Chamber of Commerce did a survey and found that the top concern of small businesses in the state was health insurance costs. As such, Governor Mills, when she took office in 2019, directed us to tackle this problem. After extensive stakeholder discussions, we developed a bill called the Made for Maine Health Coverage Act that was passed unanimously on a bipartisan basis on the eve of the COVID-19 pandemic in March 2020. In addition to simplifying cost sharing, as I mentioned, for both the individual and small group markets starting next year, establishing a state-based marketplace called CoverMe.gov, which successfully launched last year, has reversed enrollment declines. It also authorized us amending an existing state innovation waiver that has reinsurance for the individual market to help small businesses. So the plan has two major parts. First of all, we merged the individual and small group market, two relatively small markets. Small group market in Maine was declining rapidly. We pooled them to create more stability in our insurance system. And second, we extended the reinsurance that had only applied to the individual market to small businesses in that pool market. And because small businesses tend to be a little healthier than the individual markets, when we pool them, the individual market premiums go down. We get greater what's called federal pass-through payments for reinsurance, which we can spread. So both individual market continues to get the benefits of reinsurance, and newly our small businesses get the advantage of risk pooling our premiums as well as reinsurance. So what is the results? On September 1, Governor Mills announced that the weighted average health insurance premium for small businesses in Maine will fall, not just slow down in terms of its growth increase. It will actually be lower next year than this year, which is the first such reduction in Maine in over 2 decades. And I can't find any other states that have had this kind of experience coming into this year. Additionally, the state was able to use American Rescue Plan state funding to do a small business relief program, $50 per member per month, plus more for families. That is also, beginning in the pandemic, ending next year, will stabilize this market. As a result, our Maine State Chamber, when they did a survey this year, found the cost of small business going from a number 1 concern to number 5 concern. This is just the start. We will look in the future with other ideas to look at ideas like ICHRAs and COSERAs and other HRAs to see how we can build on the pool market. But going back to these themes of simplification and integration, there are ways that we can recognize that the employer-sponsored insurance system is here. We need to improve it, especially for our small businesses, but there's ways to do that in partnership with the individual market to do a win-win for both places, both types of people. Thank you.
Thank you, Jean. How about Dr. Gonzalez? Do you have anything else you'd like to add for the panel?
Yes, thank you. I think that although there is still a lot of work to be done in this area, I've been doing medicine for 20 years, and I do have to say that this has been a topic that we have been bringing up for years. And finally, it looks like we're taking great steps forward. We had the Inflation Reduction Act, which was really a breakthrough in a lot of the things that we had been advocating for various years. I think it's also important for us to remember, our panelists have talked about some amazing partnerships and options for employers and employees to help get better access to healthcare. But I don't think that many people are aware of what exists. And so as small group organizations that are helping, small businesses, I think it's something for us to keep in mind to make sure that we're educating our small businesses, because that's going to be key in them being able to, take advantage of some of these programs and partnerships.
Thank you, Dr. Gonzalez. Catherine?
Sure. I love what Jean talked about in Maine. I think it's a really interesting model that a lot of other states are looking at. I think one of the fascinating things about the individual and small group markets is that just sort of depending on the structure of the economy and sort of what the small business sector looks like and who's in the individual market, the sort of relative positioning of the small and individual market really varies state to state a lot. And in fact, there's every year, people look at sort of the relative place of small and individual premiums, to sort of look at where, what parts of the country does it sort of make more sense for the small group to think about the individual market, because maybe the premiums are relatively more affordable. Some places, that is the case. Some places it's not. And it's sort of that positioning of those two markets is different everywhere. And the only other thing I'd just like to mention is some related work that we're doing in New Jersey, which is, sort of my state, that has a couple of years ago, the small group market became smaller than the individual market after, it was a very long time, but the lines crossed in, 2019 or 2020, not that long ago. And not sure that's going to reverse, but we have done a survey in New Jersey that's quite similar to what Emily talked about at the beginning of the presentation, which we had a business and industry group, and we really worked with Rutgers, the Center for State Health Policy, and Wakely, and the questions were designed to be very, very similar, if not exactly the same as questions in the MEPS, the Medical Expenditure Panel Survey, to try to really look at the comparison. And results were quite similar to things that Emily talked about at the beginning of the presentation, that, cost is a big factor. And again, approximately 7% of respondents said they had either ICHRA or QSARA, which was interesting that it was kind of the same. And again, just a huge number of employers completely unfamiliar with the concept. So I kind of think of New Jersey as a more traditional state in a kind of a health insurance context. So I would think of that as sort of a low ball. And what we're looking to do and what we hope to do is to repeat that exact same instrument in maybe a state that I kind of think of more on the other end of the spectrum. And I'm hoping that we're going to be able to field that survey in Colorado and kind of get some more sort of numbers. And I know the Hra Council is putting together some stats, and I'm kind of looking forward to seeing what they release as well. So yeah, that's all for now, but I'll hope to have some new data on employers soon.
Thank you, Catherine. And Brian?
Thanks, Mariana, and thanks to the entire panel. My friend, a really good economist, Casey Mulligan at the University of Chicago, is out with a recent paper just quantifying the large value that employees receive from employer-provided health insurance. I think recognizing there's a lot of value there, there's also significant problems. Michael Cannon at Cato has written pretty persuasively that this is all employee money. It's their compensation, and it's under the control of the employer. It's not under their control. They don't have agency in how to best allocate their healthcare dollars. I think the approach we had in the Trump administration was what we could do to expand options, particularly aimed at small businesses, through making it easier for them to join together through association health plans and get the regulatory advantages that large businesses get. And then, I mean, the one I'm most excited about clearly is ICHRA's, allowing employers to provide that contribution that employees can take and purchase plans that best work for them. I do think I appreciate the suggestions or the comments that there's some complexity. I think there are entrepreneurs that are working through those complexities and trying to make it as simple for employers and employees as possible. There's also incentive problems at play. I think agents and brokers have gotten very used to the group model of health insurance, and moving to a model where they are going to be working with individual employees and having to help them select coverage is a different model. It's probably somewhat more challenging, and figuring out as well as what the financial incentives need to be for at least there to be parity, that the ICHRA option gets this sort of same status as the traditional group plan. So I do think there's a lot of education that needs to be done as well. Thank you.
Thank you. I want to thank all the panelists for their insights. Jean, Brian, and Catherine for sharing your experiences on federal and state level and also in the policy world. And Dr. Gonzalez for giving us a real life, real world practical view of what this means for a small business. We very much appreciate it. Thank you to the audience for your insightful questions. And with that, I will turn it back over to Rhett.
Awesome. Well, thank you, Ariana. And let me give my thanks to the panelists as well. This was like an all-star cast of bringing folks together from a diversity of perspectives, all focused on the small group. So shortly, we're going to hear some remarks from Congressman LaHood. But before we do that, I did want to share, I wanted to pick up where Brian and Erica left, which is there's so much going on, particularly just across the healthcare landscape. But I think in particular for small employers, and as someone who's worked with small employers for a number of years, it is increasingly difficult for them to really grasp and understand what's going on, because every day they are inside their businesses doing what they do best, which is make their businesses operate. And so we're thrilled to announce that today, post this event, we are launching a one-year education and outreach campaign to really help small employers understand what's going on in the healthcare market. And as part of that, we'll be talking about some of these new options that are coming online as potential options for small employers, as you heard about, but also educating them about broader changes that are going on in the healthcare marketplace and trying to make it easier for them as small employers, and quite frankly, the people who work for them, to be able to get access to healthcare and health coverage in the way that they should be. Because I think one of the common themes we heard on the panel today was how important small employers are to our economy. And I think everyone agrees that finding the right solution, and it's important for them to be able to have the sort of targeted education and outreach they need. So we're excited to launch into that partnership again with the Robert Wood Johnson Foundation. We'll be partnering with local business organizations, chambers of commerce, Rotary clubs, diverse business associations to have these conversations, these educational events, and partnering with some of the folks who you heard on the panel today. So for all of you who are joining us today, look for more information on that. We're very excited about that. So with that, pleased to be able to share that we'll receive some closing comments from Congressman LaHood, and we'll move to that next. So with that, over to Congressman LaHood.
Good morning. I'm Congressman Darren LaHood, and I'm glad to be with all of you today. I represent the 18th District of Illinois, which covers central and west central Illinois, including Bloomington Normal, Springfield, Quincy, and Peoria. In Congress, I am proud to serve on the House Ways and Means Committee, which has jurisdiction over taxes, trade, and healthcare. I also serve on the House Intelligence Committee. As a Republican on the Ways and Means Committee, I work to ensure access to low-cost, high-quality healthcare that supports employers and small businesses' ability to provide robust health coverage and preserves patient choice. As we've seen throughout the pandemic, a flexible, accessible healthcare system is important for constituents. Congress made significant progress in their support for additional healthcare flexibilities, including telemedicine, greater use of health savings accounts, and support for employers to provide greater benefits to employees. In the first round of COVID-19 aid, my bill, H.R. 1922, the Restoring Access to Medication Act, was passed and provided access to over-the-counter medication, among other products, as eligible for HSA spending. I believe that it's important to continue that progress to provide patients and constituents the opportunity to control their healthcare decisions, allow employers greater access to provide quality healthcare choices for their employees, and lessen the rising complexity and cost of healthcare. Small businesses are the backbone of the U.S. economy. working to ensure our communities continue to thrive and supporting jobs and economic opportunities across the country. Constituents and employers in rural communities seem to suffer the greatest, as access to high-quality care can be challenging. While I believe there is bipartisan support to address policy issues that impair healthcare access and lack of coverage choice, both in the employer and small group markets, there remain barriers to care that we must all focus on. Healthcare cannot be a top-down approach from the federal government. We must work to provide competition, choice, and access. That is what I and Republicans will continue to do in the next Congress. Thank you.
Wonderful. And with that, I want to once again thank all of our amazing panelists for this conversation and making time to join us today. As a follow-up to this, we'll make sure to include the research as well as the video for everyone who registered for today's event. And with that, this is now the close of the event. Thanks everyone so much for joining us, and have a great day.